Medical or magical? It's a common thing in Chinese movies and TV shows. A traditional Chinese doctor can supposedly tell whether a woman is pregnant or not simply by feeling her pulse. Yes, that's right. No pregnancy test, no urine sample, no ultrasound. Just a quick check of the pulse.
The pulse of a pregnant woman is like a cluster of beads, while common people's pulse is like simply a string. It is because the blood output of an expectant mother's heart increases sharply. Pregnancy is not the only account for this pulse change, but if other tests are excluded, it's clear that the one is pregnant.
The method is one of many used by practitioners of traditional Chinese medicine. But does it really work? It's been a hotly debated topic on social media in China recently. So, a doctor at Beijing Jishutan Hospital, a non-believer in the method, is putting it to the test using a sample of women, some pregnant, some not. Dr. Ning Fanggang has offered 50,000 yuan, or about $8,000 to any TCM doctor at a reputable hospital who is able to tell who is expecting with an 80% success rate. Professor Yang Zhen at Beijing University of Chinese Medicine is the first to accept the challenge.
My students who are active on social media sent me the link. There are some doubts of the accuracy of our pulse check. So I said, okay, let's show them all.
Dr. Lu Jilai from Sichuan province has also come on board. In a small trial test of 5 people, one of a man, Lu only managed to detect the sole pregnant woman on his second attempt. Later he said he was forced to quit by pressure.
I think Dr. Lu's test is what the audience want. It's purely a show. Maybe it's also what Dr. Ning expected. But I want to do something scientific with Ning, not for entertainment. So more samples are needed, and many moral and legal issues are involved.
No date has been set for when the challenge will take place due to disputes over how it will be conducted. But Professor Yang is confident he will win the prize money. Professor Yang provides medical service twice a week here. He's also a California state licensed acupuncturist. The certificate was established in 1970s and can be used throughout the U.S. But a lot more is needed before traditional Chinese medicine can truly go global. Among all TCM treating methods, acupuncture was the first recognized in the U.S. 44 states have now passed the law allowing the practice to be taught to those studying medicine. But Chinese herbal medicines are a different story. In California, the products have to be labeled with warnings that some are known to cause cancer, birth defects, or other reproductive harm. Also, the European Union banned traditional herbal medicine in 2011.
First, there's legal issue. No Chinese patent drugs have obtained EU license, as no producer can afford the huge expense. But I think it's more a cultural difference. The West has different way towards medicine and science. That's the major obstacle for West to learn about TCM.
Despite that, more and more Chinese people, like Dr. Ning, are starting to voice their criticism of TCM, calling it witchcraft.
It's a historical problem. In the early 20th century, Chinese people learned the Western science for the first time. It's new to us, and it's easier to go crazy or even go to the other extreme, denying all our traditions.
Others point out that it should never be a life or death struggle between East and West medicine.
Though Western medicine and TCM are based on different theories, the two sides could make their advantages complementary to each other. Under either framework, the opposite is defective. It will be a great help for human health if we can combine them together.
Traditional Chinese medicine has a long history, dating back to the age of the Yellow Emperor. For thousands of years, Chinese people have built up great trust in its ability to fight disease. For those who grew up before the arrival of Western medicine to China, the practice cannot be demonized. Modern people, though, may struggle to understand how it works. Professor Yang says, with a little more knowledge, people may come to appreciate the unique power of this ancient Chinese tradition. Either way, many will look to the pregnancy contest as a measure of its effectiveness. Li Chaoran, CCTV, Beijing.